Hello, my name is Tessa. I'm gonna phone in. I'm gonna be doing the newborn assessment today. Is that all right? Perfect. I'm gonna check and make sure that this is our baby. ID band says Anna. Perfect. Okay, I'm gonna go ahead and start listening to her. After listening to respirations, she was 30 to 60 per minute, and her heart rate was 110 to 160. Her 4 quadrants of her tummy were all active, and her temperature is 97.7 to 99.5. All right, I'm gonna go ahead and start with her head. I'm gonna check for signs of molding, going around in a circular motion. I don't see any molding. We have small, soft fontanelles and flat. And the suture lines are not overlapping and they don't have too much space in between. She doesn't have any scratches or bruising on her head. And she doesn't have any overall fluid, or it's called caput cysteum. I can never say it right, I'm sorry. And I'm checking for a bruise on one side of her head or the other, and I don't see any. That would be called a cephalohematoma. Now I'm going to be checking out baby's eyes. One eye is 1/3, bridge of the nose is 1/3, the other eye is 1/3. I don't see any discharge or subconjunctival hemorrhage, which would be bloody eyes. And I don't see any epicanthal folds, which are more common in Asian descent babies. The eye to ear spacing is good. Her ears have good recoil. Now I'm checking for her nose patency, which is good. I'm gonna go ahead and put on some gloves. Baby is rooting and has good sucking. I'm feeling the hard and soft palate, both are good and intact. Now I'm gonna start to uncover baby a little bit. I don't feel any lumps or bumps in her neck. And while I'm doing this, she's flailing all around, so she's got some good range of motion. And her clavicles are not broken, which is amazing. Now I'm checking for signs of respiratory distress. I don't see any nostril flaring or any gasping. I'm not hearing that. And I'm not seeing any retraction. And she doesn't have any periods of apnea longer than 20 seconds. And I'm not seeing any asymmetrical or seesaw breathing. Now I'm going to look at her tummy. Her tummy is soft and rounded. It's not tender. And while I've got her all open, I'm just going to check her skin. She's overall pink on both sides. I don't see any scratches or any bruising or birthmarks. And I'm going to go ahead and test for jaundice. We start with the forehead, chest, abdomen, thigh, and we're going to go back to the eye. That looks good. Now I'm going to go ahead and look at her umbilical cord. It is good and dry. It's not red and doesn't show any drainage or any signs of infection. Now opening up her diaper, I'm going to cover up the top half of her. Opening up her diaper, it looks like her labia majora cover her labia minora. She doesn't have any discharge or any bleeding, but that would be normal in a newborn. If she were a male, her foreskin would be intact, and I would feel for the descended testes. Her testes are, his testes would be descended, and he has deep rugae. I'll go ahead and put his diaper back on, making sure that his umbilical cord is out. Checking the toes. She's got 10 toes on each foot. I'm checking for the Babinski and her toes fanned out. Same on this foot, and she had 2/3 creases in each foot. And in her hands, she's got 5 fingers on each hand and multiple creases. If she had one crease, that would be some distinction with Down syndrome. I'm gonna go ahead and roll her over. Her spine is good and straight. She doesn't have any dimpling or tufts of hair down by her sacrum. Overall, baby was very good. She was a little bit fussy, but that is to be expected. She just had a bowel movement about 30 minutes ago and needs to be fed in about 10 minutes. And that is all. Thank you.